Hey guys, Dr. Thomas Romero here with Optimal You. A big topic that's been coming up a lot lately is mouth breathing. People don't really think about neurologically what can be happening when you mouth breathe. When you mouth breathe, you actually are shifting your breathing from your diaphragm and in your belly breathing into more of your chest breathing, which mimics more of a panic state breathing. This forces your body into a sympathetic nervous system activation, meaning heart rate up, blood pressure up, respiration rate up. It makes us feel anxious. It makes us feel uncomfortable. So it's very important that if you identify somebody who's mouth breathing, that you do your best to help them and switch the breathing back to being in their nose. Your nose has all these different hairs. It has a filtration mechanism built in that when you breathe in through your nose, you're going to be actually giving yourself a huge justice immunological wise compared to when you mouth breathe. When you mouth breathe, you're not utilizing these nose hair cells, this extra filtration system that your body is innately built in to help you fight off disease and pathology and just common colds and bugs that you can get. But another thing that people don't really focus on, again, goes back to the neurological component, which is that sympathetic nervous system is going to be turned on over the parasympathetic nervous system. So when you identify somebody's mouth breathing, you can know that they're going to have a much harder time getting the heart rate reduced, getting the blood pressure reduced, getting the respiration rate reduced, and they're going to be compromising the enamel on their teeth from the acidification that occurs in the mouth from when you mouth breathe. There's a lot of negative things that occur in the body when you're mouth breathing. So if you're identifying somebody with mouth breathing, understand that one of the main things we need to do is we need to shift them out of that sympathetic nervous system state. We need to bring them back into parasympathetic nervous system activities. Rest and digest. When you're breathing through your mouth and you get stuck in this sympathetic nervous system state, you can no longer activate things that the parasympathetic nervous system are working with. When your parasympathetic nervous system's activated, you are shunting blood from the muscles and putting blood into your gut so that way you can absorb your nutrients, you can absorb your vitamins, you can absorb everything you're taking in, which is going to repair and heal your body. When you're in this sympathetic nervous system state, you actually have an inability to absorb, and it actually is shunting blood away from your digestion and putting it toward your muscles because it's preparing you to have to run away from that predator. Whatever fear is arising is preparing you to have to use your muscles to run. Here at Optimal You, we offer a variety of therapies and treatments that are going to directly activate that parasympathetic nervous system to pull you out of that sympathetic nervous state and pull you out of that fight or flight, get you back into the rest and digest. So I hope everybody takes this as an opportunity. If you know somebody who's mouth breathing, tell them to give us a call. We can help greatly. And there's plenty of little tricks that we can teach them to utilize at the home to really take care of this issue.